Today, we as members of Congress have the opportunity to complete an effort that actually began decades ago. Now, the status quo has a powerful lobby, and the centuries of status quo have killed health insurance reform before. And they're pouring all their energy not into offering constructive solutions, but to erecting new pillars of obstruction at every turn. Each of the various reform plans that have been brought forward by now has its strengths and its weaknesses. We all know that, but one thing we should know, radical reforms, they are not. As President Obama asked, these proposals are based on the existing system of employer-based private insurance. But in the absence of comprehensive national reform, several states have helped fill the void by crafting some of their own solutions. I'm proud that my home state of Vermont has been a leader and innovator in several issues that are now being wrapped into the reform package. One such provision mirrors a pilot program in Vermont, the Blueprint for Health. This coordinates care among patients and does it in a way to prevent costly hospitalizations and procedures. Patients who participate in the program have their care monitored to ensure they're receiving the kinds of preventative services and disease management that they need. And the Blueprint rewards physicians who keep their patients healthy. The program's already slowed costs, and of course it's reduced emergency room visits. Vermont has also coordinated patient care as one of the states at the forefront of the movement toward electronic medical records. That's a reform I've long promoted. Recently, I visited Montpelier Pharmacy in our capital city, a small city of 8,500. I had the privilege of being born there. But I visited Montpelier Pharmacy to announce a grant I secured to help small pharmacies across Vermont adopt a system for electronic prescriptions. With electronic prescribing, you can have all kinds of computer safeguards to prevent dosages from being too large, or also prescribing a medication which may conflict with another medication that's already been prescribed. And the system gives the physicians, but also the pharmacists, a concrete medication history that doesn't rely just on a patient's memory alone. In fact, if you have a patient who cannot or does not remember what medication has been taken, this can be life-saving. It's a little bit better than a patient saying, well, I have that small white pill and I think it's something for heart or something like that. They can just press the button and know exactly what they have. But the contraindications are for other medications. And Vermont's also been a national leader in children's health care and expanding coverage for low-income Vermonters through the Medicaid program. All this in a little state of 650,000 people. But because of our early action, 96% of Vermont's children have health insurance. Now, our little state, not a wealthy state, but 96% of Vermont's children have health insurance. And we have one of the lowest rates for uninsured adults in the country. It makes Vermont a leader and model for the rest of the nation. Now, the proof is in the pudding. You have 96% of the children with health insurance, the lowest rates for uninsured adults. So it should be no surprise that Vermont has been ranked the healthiest state in the nation by the American Public Health Association and the Partnership for Prevention, and ranked #1 in health care by the Commonwealth Fund. We can talk about things to do, but when you actually do them, it works. And while Vermont has been a model in coordinating care and offering wider health coverage through public programs, a provision to expand Medicaid coverage nationwide threatens to penalize states like Vermont that have acted early to do the right thing. States like Vermont that did not wait but went forward to protect the people in their state. Instead of rewarding states that have taken the initiative to expand the Medicaid programs early, one of the Senate bills would require states that have been leaders in expanding coverage to accept less federal assistance than other states that have offered only the bare minimum of coverage. In other words, it penalizes those who have done the right things and rewards those who have done the wrong things. Taxpayers in early leader states like Vermont would be forced to sustain programs in states across the country that traditionally ignored the needs of their citizens. So to address this disparity, I recently joined with 13 other senators from early leader states to offer a proposal to treat all states fairly. We can all share the goal of increasing access to essential medical services by expanding Medicaid coverage nationwide. I look forward to working with others doing in a way that does not misguidedly harm our early leader states. Even though Vermont's long recognized the importance of a health care system that includes all Vermonters, all Americans, individual states can't make enough progress without comprehensive health insurance reform. We need that. Workers nationwide losing insurance for their families and they change to lose jobs. Insurance companies can and do discriminate against sick people. Notwithstanding what the hundreds of millions of dollars worth of ads say, they can and do discriminate. And I hear heartbreaking stories daily from constituents in Vermont. They tell me the problem they're getting paying for and keeping health insurance. I hear it when I'm going through the grocery stores at home. I hear it when I'm putting gas in my car at home. I hear it when I'm walking down the street or coming out of church. Like the woman from Win Hall, Vermont, who spends $500 a month on prescriptions, $500 a month on prescriptions, but she'd be uninsured if not for her husband's job. And she's working two jobs just to make ends meet and afford the health care costs. Or the small business owner in Vermont who has 3 full-time employees and 1 part-time worker, and he works 6 and 7 days a week, or she does work 6 and 7 days a week, but she can't afford the blood test her doctor recommended. If she becomes sick, she'll lose her business, she'll lose her home, her employees will lose their insurance. Or the man from Central Vermont who told me of his sister-in-law who lost parts of both feet because she didn't have health insurance. She didn't have health insurance, and when she needed medical attention, she just waited hoping things would get better. Well, they didn't, and she had to be rushed to an emergency room for amputation. It's real-life stories like this that make us ask, why are we the only industrialized nation in the world that lacks health insurance for its citizens? Why the wealthiest nation on earth lacks health insurance for its citizens? Why the most powerful nation on earth lacks health insurance for its citizens? It's shameful. We owe it to all Americans to pass meaningful reform. And I strongly believe the best way to meet these goals include a public health insurance option, health insurance reform. A public option would give consumers more choices to purchase an affordable and quality health insurance plan. It'll bring about competition, it'll bring down costs, and I applaud the majority leader for saying the Senate bill will consider this. In order also to introduce true competition in the insurance industry, we have to end the exemption from antitrust scrutiny. They don't have to follow the antitrust laws that virtually every other company does. And if they're not doing anti-competitive things, they shouldn't worry at all about removing the antitrust exemption. Now, we know our current health system is unsustainable. It threatens not only our health security, but also our economic security. Doing nothing has been seen as an option before. It's always easier to do nothing. But that's not an option now. We tried doing nothing for years, and the situation has grown worse. So let's debate, and let's pass health insurance overhaul in the coming weeks. Let's give Americans the competition they need. Most importantly, let's give Americans the choice they need.